Conversations on mental health have helped break stigmas and encourage wellness over the years. Despite this progress in mental health, however, one thing remains a problem for many Filipinos, and that is the issue of access. We are joined this morning by the president of Philippine Psychiatric Association, Dr. Joan Mae Perez Rifareal. It's a beautiful day, Doc Joan. Welcome back to the show.
Hello, thank you very much for having me, Anne, and of course to Paolo and Monique. And it's a beautiful day. Thank you very much.
It's always a beautiful day when you're here to guest on the show, and you are now our resident psychiatrist, Doc.
Thank you. Thank you.
But going to our topic this morning, a lot of people, they go to the gyms, they take care of their physical health, but mental health is actually as important as physical health. But the sad reality is, these therapies and treatments are not easily available as gyms and maybe yoga studios and sports centers, right? Doc, can you tell us what are the factors that prevent Filipinos from getting therapy, and how can we make therapy more accessible to everyone?
Yes, Anne, as you've mentioned earlier, the stigma is still there. There is still negative perception towards mental health, especially in sometimes no, we there's judgment, there's discrimination when we hear about someone who may want to seek help for their mental health concerns. So the stigma is still there, discrimination, the judgment, and that's why we are really thankful for platforms like this, where we can discuss about mental health in a safe space without any judgment. Another factor is accessibility. As mentioned, for the PPA, for the Philippine Psychiatric Association, there is about maybe 500 to 600 only of us psychiatrists for a population of 110 million Filipinos. And that's why accessibility to services can be a concern as well. But with the PPA, we've been continuously working on reaching the unreached. We are here to help. And that's why we have been partnering with NGOs, collaborating with our colleagues from the Philippine Psychological Association of the Philippines, the guidance counselors groups, and other groups who also advocate for mental health. And we also do training of primary care physicians and other healthcare workers in terms of at least being able to assess and help us with a diagnosis of mental health in the barangay levels and LGUs.
Well, Doc, you mentioned that access of obviously,
Yeah.
well, it boils down, almost practically speaking, to the low number of medical practitioners in this particular field. I know that you have been, or at least a lot of your colleagues, have taken to technology to try and make it more accessible. There are online consultations, online sessions that are accessible through via apps. But is there any reason in particular that you feel na medyo konti ang mga mental health practitioners dito sa Pilipinas? Are students not getting enough incentives or not looking at this as a viable career choice in their future?
Thank you for this, Paulo. In fact, before, when I was still in med school, mental health kasi during that time was not really being talked about because, again, of the stigma and negative perceptions about it. Unlike in other countries where it's really very acceptable when we say, but they're very even proud to say now they're seeking help for their mental health concerns. But recently, especially now, we've seen a trend. I also am a training officer, meaning I also train the younger doctors who are pursuing this specialization on psychiatry. So we have seen a steady increase in the number of young doctors who are interested to pursue psychiatry as their specialization after med school, after passing the board. So we've seen a steady increase in the number of applicants. And I think this is due to an increase in the awareness of mental health concerns, mental health, how it affected us, especially during the pandemic, years, not during the pandemic, we've seen an increase in the number of individuals who were really talking about having these mental health concerns like anxiety, depression, and so the passage of the mental health law also in 2018 helped with this increase in awareness. So yeah, has been a steady increase in the number of young doctors who are pursuing this now.
Doc John, I heard you had a show. That's why pala you're such a pro in front of the camera. You have a show called Mind Matters. So can you talk more about your show and what do you guys usually talk about?
Oh, just to Monique, just to clarify, this is not my show. This is
Okay.
a flagship program of the Philippine Psychiatric Association. So we partnered with one of the radio stations here in the Philippines, and the goal really is to help raise awareness on the more common mental health concerns. And during this 1 hour radio program every Saturday, we encourage listeners and viewers to ask us anything about mental health concerns that they may have, questions, really to help them better understand the current state also of mental health in the country. So we talk about the more we had our 11th episode last week, so it's really new. We started this year, and we are happy that we've been getting questions about depression, anxiety, substance use, maternal mental health, especially for this month of the Women's Month, for this month of March.
Yeah.
We also discussed about cancer. So really, we discussed on a variety of topics with mental health as a primary focus.
Yeah, Doc, you mentioned the current state of mental health here in the Philippines. Can you expound more on that? What is the current state of, I guess, seeking mental help here in the Philippines?
Yes, yes. In fact, from the WHO numbers, it's about one. There is about 1 in 5 of us Filipinos who may have some form of mental health concern, and the more common would be depression or anxiety, substance use, and of course, one of the concerns really is the lack of mental health professionals who may be able to address these concerns. And of course also there's the budget na yung medyo there's budget has not been maximized fully for us for us to be able to deliver and to make mental health as accessible, affordable for all. But again, we are optimistic that with the passage of the mental health law, now with the universal healthcare law, and yeah, we work, of course, PPA, our mission and vision is to align with all of these laws to help our kababayans in terms of helping us raise awareness and seeking help and making access better for all of our kababayans down to the LGUs and barangay levels.
Doc Joan, mental health services, they're mostly focused on the urban areas. Are efforts being done to reach out to rural communities and give them the help that they need as well?
Yes, of course. The WHO, in fact, has an initiative. We call this the MH-GAP, Mental Health Gap Action Program. And with this program, the psychiatrists, we help train the primary healthcare physicians in the barangays, in the LGUs, municipalities, and of course, with this training now, they are better equipped and empowered to at least identify the signs and symptoms of the more common mental health conditions, and they also are trained on how to give first aid or primary care treatment for patients who may present with these disorders. But if, of course, there is also that referral system wherein they can, of course, they can refer to us, the specialists, if really there is a need to have further assessment and consultation with a specialist. So trainings are being done, and we also collaborate with workplaces. So we have outreach programs. Currently, we have an ongoing outreach program to help with the assessment and management of mental, neurological, and substance use disorders or concerns. We have an outreach program in Baler, and hopefully we can extend this to other areas as well across the nation.
we're seeing more and more support for mental health in general. Education Secretary San Angara with the implementation of the Basic Education, Mental Health and Well-Being Promotion Act. There's also the fact that you mentioned there's some more trainings happening in the barangay level, trying to reach out to more people, just so people can understand the snapshot of everything that we are saying here. And before we let you go, Doc, the supply and demand when it comes to mental health access, how are you overwhelmed in terms of the amount needed that needs to be treated, amount of people that need to be treated, considering the fact that, na-mention nga natin, I think you said 500 or so estimate who are actually psychiatrists who are able to treat people?
Correct. Yeah, sometimes I mean, it's very common that it may take some time for an individual to get an appointment. So that is a concern, which of course we are aware of, and we are really doing our best to accommodate as many as possible, especially for those with emergencies, those who may present with symptoms of negative thoughts, self-harm. So we always advise to seek help, reach out and seek help, because help is always available. They can go to the nearest emergency facilities. There are hospitals with psychiatric services 24/7, especially for those training institutions with psychiatry as a training program. Like, for example, in Metro Manila, we have the National Center for Mental Health. They have a crisis hotline. It's 1553. So for any immediate concerns, for emergencies, they may call that number.
Yeah.
And also, we also have emergency treatment facilities for some of the hospitals here in the Metro Manila and in Luzon, Visayas, and Mindanao. Currently kasi,
Yes, po.
that's why we are very happy, kasi before it used to be just a few hospitals with training programs for psychiatry. Now we have currently 20 training institutions across the Philippines. So it's not just purely in Manila, but we have in Visayas and Mindanao as well. So now we are really reaching the unreached through all of these training institutions, and we've seen a steady increase in the number of younger doctors who are very much into mental health and training to become our future psychiatrists and leaders in mental health.
Doc, we really appreciate all of the words, and of course, for those who need their help mentally, don't be afraid to reach out to anyone that is anyone that she actually referenced a while ago. Also, reach out to Doc herself. I'm sure she'll be willing to put you in her schedule as well. Thank you so much. She is the president of the Philippine Psychiatric Association, Dr. Joan Mae Perez Rifareal, also the therapist of Anne. Maraming salamat.
Thank you,
so much.
Paolo and Anne. Maraming salamat po.